also the proud principal. Without further ado, I'm going to introduce Mayor Keefe Johnson.
Thank you. It's such a pleasure to be here at Keefe Avenue Elementary School. Mr. Principal, and thank you for that introduction and for hosting us here at Keefe Avenue. So today is really, really exciting, and it's exciting for many reasons. Having the CDC here on the ground in Milwaukee, in the same room as Milwaukee Public Schools, in the same room as our health department, with representatives from the city focusing on lead in our community, it's validating. It really is. It reflects the seriousness of this work, and it reflects the strength of partnerships that are behind it. And I'll just go on to say that this is the sort of federal partnership that we need. This is the sort of intergovernmental federal partnership that actually makes a difference on the ground in communities. I want to thank the CDC for being a partner in that. It's also exciting because we're here to talk about a proactive step forward. Thanks to a nearly $400,000 grant from the Centers for Disease Control and Prevention in collaboration between the Health Department, the Milwaukee Public Schools District, and community partners, we're expanding school-based lead screening for students right here at Milwaukee Public Schools. This funding allows screening to happen inside the school and in the comfort of students' own schools at no cost to the student, at no cost to their family. Let me just repeat that again, all right? So we're expanding the access, and students will be able to get access inside the comfort of their own school and at no cost to them or their family. Instead of scheduling a separate appointment or traveling to a doctor's office, parents in Milwaukee can simply sign off on their children getting screened for lead in school at one of these clinics, and making sure that child blood lead tests are more accessible now than they ever have been before. So they're way more accessible, or they will be, thanks to this partnership. So I want to thank Milwaukee Public Schools. I want to thank the Milwaukee Health Department, our partners at the CDC for being here, for the work that's brought us all to this moment. Just over a year ago, many of you have followed this story. We were facing a very serious public health challenge right here in our community. It was stressful for families, and it certainly was stressful for students and our entire community here in Milwaukee. But through hard work, through transparency, through collaboration, and most importantly, a dedication to the kids that all of us serve here in Milwaukee, it all evolved into something proactive and forward-looking. All of that work strengthens our systems and protects children here in Milwaukee. And it goes to show that Milwaukee works together to improve and move forward, and we do that in partnerships that I talk about a lot in my job as mayor. With that, I am so pleased and privileged to bring up and pass the mic to a partner in this work who's been really, really outstanding, the superintendent of Milwaukee Public Schools, Dr. Brenda Casellas.
Well, good morning, and thank you, Mr. Amdel, for welcoming us to Keefe School and having us here today. And thank you, Mayor, for your incredible support, and Commissioner Tortoritis as well, and his entire team, really, that you see standing with him. I want to thank Dr. Awal and also our CDC partners, Commissioner Tortoritis and the Milwaukee Health Department, Board of Education President Zambor, and our school community for being here with us today. We're also grateful to Novir and Cole for supporting the district's on-site lead testing and family outreach. Over the past year, MPS completed district-wide lead paint stabilization ahead of our deadline, and we have strengthened our day-to-day systems to maintain safe learning environments for our children. Today's event reflects the additional and ongoing work of prevention and early identification. With the support of Milwaukee Health Department CDC grant, we're bringing blood lead screening directly into our schools so that testing is easier for families and children who need it most. For families, the message is very simple for us. Student safety is our top priority. School-based screening is about reassurance, transparency, and catching potential concerns early, because we are committed to doing everything possible to protect children's health and their learning and success in life. Exposure often happens outside of school, especially in older homes, and testing is the best way to know if you have been exposed. MPS is here to partner with our partners at the health department on screening, follow-up, and all supports as well. We also remain committed to transparency. Information about our district's lead safety plans and our ongoing preventative work is available at mpsmke.com/lead. I want to thank our families, our educators, and our incredible partners for your trust and collaboration. Together, we have moved from response and emergency to prevention and care, and we're keeping our focus where it belongs, which is on our kids, so that they can learn and be in clean, safe learning environments. And with that, it's my pleasure to introduce Milwaukee Public School Board President, Missy Zambor.
Thank you, Dr. Caselius. On behalf of the board, I want to express our gratitude to the CDC for supporting this important community service. We've taken the necessary steps to make our schools safe, and the board will get an annual update on continuous work to make sure they stay that way. That allows us to focus on other sources of lead that pose risk to children, including older homes. And it's so important that we continue to partner with the health department, Cole, and Novir to offer testing. We've seen a strong response to the school day testing that families opt into, and we will continue to offer that as well as testing open to the community as we are doing today. Thank you again to all of our partners in this work.
Good morning, everyone. I'm Mike Totoras, the Commissioner of Health for the City of Milwaukee. I want to share how grateful I am for the support and collaboration we've received over the last year. Thank you to Mayor Johnson for your leadership and continued support. Thank you to our partners at the CDC for being here in Milwaukee this week. Your expertise and partnership are valuable, and we're looking forward to moving forward with you. Thank you to Superintendent Caselius and the Milwaukee Public School Board. I've truly appreciated working with you, Superintendent, and the board. Most importantly, thank you to the parents that have reached out to us and worked with us over this last year. We know that this has been an incredibly stressful time for you, and we're grateful that we were able to show up and work alongside the school and with our partners now at the CDC to make sure your students are safe. There are many MHC teams and staff who have been deeply involved in this work over the last year. I in particular want to recognize Deputy Commissioner Tyler Weber and Home Environmental Health Director Mikhail Mannon. Both of them have been instrumental in leading the department's response to this issue. The progress we have made is significant. The CDC funding to the health department will allow us to bring lead screening to MPS students here in their schools. By providing testing directly in these schools, the health department can identify elevated blood lead levels in Milwaukee children earlier, begin our investigation sooner, and connect families to resources quicker. Early identification can prevent long-term health consequences that no child should have to face. This is public health in action. Prevention, partnership, and protection working together. I also want to take a moment to thank Novir for providing these screening clinics, and in particular recognize Cole, our Coalition on Lead Emergency, for partnering with us to reach families and ensure that they have information and access to the consents for the services. At the end of the day, every child in this community deserves to live, learn, and play in spaces that are safe from lead hazards. The City of Milwaukee Health Department is committed to that mission and to doing everything we can to make it.
Thank you. Sorry.
Let's see if I can get it. Here we go.
Oh,
You good?
go ahead, I got it. I'll balance it. You go ahead, finish.
Okay. This is partnership in action.
See?
So,
See how that works?
at the end of the day, every child in this community deserves to live, learn, and play in spaces that are safe from lead hazards. The City of Milwaukee Health Department is committed to that mission and to doing everything it takes to achieve that goal. With that, I'd like to introduce Paul Allwood from the CDC. Hang on one sec. There you go.
There.
Got it? Good morning, everybody.
Morning.
It's a real honor for us to be here as partners with Milwaukee Public Schools and Milwaukee Health Department in this very, very important work. And I'd also like to just take a moment to just say, thank you for everybody that's here, including the members of the press who's here to cover this event, because, your part of this is not insignificant, helping us to get the word out about the important work that has been done, but, that still needs to get done to ensure that all of our kids are safe from lead hazards where they learn and play. The leadership that's been shown by Milwaukee Public Schools and Milwaukee Health Department is a great idea of local leadership, Mr. Mayor. And this is really a good demonstration of how public health needs to work. You've heard it by other speakers, but lead poisoning is a preventable problem. There's a key step that's necessary to effectuate this prevention, and it involves identifying the hazards, the lead hazards that are in our environment where kids play and learn, and eliminate those. And so that is what we've seen here in Milwaukee. That once it became clear that there were lead hazards and that kids were getting exposed to lead, that the community came together with a singular focus, on addressing that problem. And I think this is really a great example of what can happen when people come together, recognizing that the health of our children has to be paramount. And I think that was very amply demonstrated here. A little bit of a call to anyone who's a parent who's hearing the sound of my voice. If you have a child or children in the Milwaukee Public Schools, we strongly encourage you to have your child attend one of the free testing clinics that are being organized by the school district, and or have your child's provider, have a conversation with your child's provider about getting the child tested for lead. It's very, very important, because if we find the lead early, there's a lot that we can do in terms of putting the child in touch with the appropriate services that's going to reduce the harm from the lead. And also, if you're doing any kind of renovation in a home, or if you just live in a home that's an older home, built before 1978, and if you have not done it already, we encourage you to either have your child come to one of the free testing clinics or talk to your child's provider about having the child tested for lead. It's really, really, really very important. Thank you all very much for being here, and I think we'll turn it back over to you, Commissioner.
We'll open up for questions.
I was going to ask, does this grant and do these clinics, do they reach the level of help that you guys had initially requested last year?
Yes, we're extremely grateful for this continued support. And the other side of the grant is the expertise that we're able to confer with our colleagues at the CDC. This morning we were talking through a lot of different ideas for long-term surveillance and ensuring that we continue this partnership.
How did the elimination of the CDC's lead program, albeit temporary, complicate or prolong getting resources like this into MPS?
It certainly delayed it, but we're really grateful to move forward now with this funding and with the support of my colleagues here.
Could you confirm that the FDA request was not reconsidered, and what maybe is not happening as a result of that?
From where we are now with the team that's been brought back, we've been able to focus on the lead grant and make sure that we could provide accessible testing to families. That was really the spirit of the EpiAid, was to provide those resources here in Milwaukee for our families. So the EpiAid is moving forward right now, but we're really focusing on the grant that's providing accessible testing.
When it comes to the grant, how many clinics have you had so far, and how many are planning for the future?
Tyler, do you want to?
Yeah. Hi, everyone. Tyler Weber, Deputy Commissioner of Environmental Health for the City of Milwaukee. Today is the third clinic, so we're just getting started. Then there's going to be a short pause to say what went well, what could be improved, but there should be monthly clinics from now for the next 12 months. And we'll see how the funding works out, but 30 to 40 clinics total, potentially more. We'll see if there's more funding that can be added, but this is a strong start.
Do you know how many kids have been tested so far prior to?
Yeah, not exact number, but it's about 240.
It's more. So since March of last year, It's about 902 families or children that have been tested in these clinics, and that includes some of the more recent ones that we've had.
But then from the 2 clinics, it's 240 have been screened so far.
Are the clinics only going to be targeting elementary school children, or is there any effort to test middle school children and high schoolers, especially since some of the children already identified were over 6 years old?
We're really encouraging everyone to attend these, and I think the outreach that Cole's been supporting, and certainly outreach from the district, has encouraged folks to get their children tested. One thing that we have seen since this issue started last year was an increase in testing across the city. So we really appreciate the parents that took the time to get their children screened right away, and then certainly the folks that have come since then to get their children screened, because that's the best way to know. We're really encouraged by the data that we're seeing already, showing that there aren't additional cases yet that we have to respond to. So I think that's a really encouraging note to celebrate the work that MPS has done on the remediation, the stabilization of their schools, as well as a continued effort to ensure the safety of the students.
I'm seeing the $400,000 grant allows for the screening for up to 8,000 NPS students. Is there a plan to reach the rest of the students?
We were fortunate enough to receive additional funding through HUD that Congresswoman Moore had advocated for, so that's $750,000 to provide additional testing. So well over $1 million has been raised at this point to ensure that testing remains accessible to our students here in Milwaukee.
Is the testing supported by any other funds?
Primarily just this CDC fund right now and the HUD funding.
How quickly are the results available?
Right in that moment. So the point of care testing is a finger prick, and that will tell you an initial screening, and if there's a need for additional follow-up blood draw, then we can also do that. Those results take a couple days to get processed.
Okay. And I guess what's your message to parents who are getting those results and maybe seeing an elevated level? What should they know?
They're not alone, and we are with them during that time. The district is working with us as well, and their nursing staff. So there's plenty of people that are supporting this effort to ensure that parents know what to do in those moments. Blood poisoning can have a whole range of levels, and parents should know that we are there to work with them and to help ensure that they have answers to their questions.
Any word on how many of those tests are coming back with elevated levels since?
I don't have the exact number. It's a pretty low percentage, though. And some of those clients students were actually clients of ours as well, so we were already working with them. But we can get further numbers.
Okay, thank you.
Question for Chief Allwood. Who all from your team is here over the next 2 days, and what exactly are you going to be doing to assist the health department?
Yeah, thank you for the question. So we have our director of our division of environmental health science and practice. It's part of the National Center, one of the 2 divisions in the National Center for Environmental Health, Dr. Svensson, in the wave. And then we've got Dr. Rockert, who is the team chief for our policies and partnerships area, and has been working very closely with the city of Milwaukee in responding to the situation here. And then we have Scott Pauley, who is one of our communications specialists with the National Center for Environmental Health, that's here to help us with, this type of engagement with the media. So, we're prepared to be alongside the city of Milwaukee for as long as it takes to ensure that there is a solid plan and, really good activities taking place to ensure that every child has a chance to be protected from lead in the community. And so we're here this week to meet with partners, to get firsthand, insights into the work that's going on the ground. Just to see some of the clinics and, what actual activities are taking place, but also, to answer questions and to provide whatever technical assistance we think, would be appropriate, given the circumstances. So, yeah, we're going to be here for the long haul, and we're, really very pleased, with the type of, conscientious effort that has been undertaken by the city health department and public schools to ensure that, this problem, which, none of us would want to see happen anywhere in the country, but that, here in Milwaukee, people are putting it front and center, and everybody's coming together across, various different groups and organizations, including, parents' organizations, to ensure that the spotlight stays on this problem until we have it addressed.
We've got time for one more. How, again for Chief Allwood, how has your work changed since being reinstated, especially when it comes to local efforts like here or like in Flint, Michigan?
Yeah, so, our program is committed to ending childhood lead poisoning as a public health problem in the entire United States. And that hasn't changed. We came back with eagerness to get on with that work, and we're doing that. And and this week we're here in Milwaukee, with that same kind of determination and passion to carry on the work of ensuring that ultimately there will be no child in the United States that will be victimized by lead poisoning.
Thank you. As we get ready to close out here, and thank you. I know that was the final question, but I just wanted to put a finer point on what I mentioned earlier. And this is partnership. Right? This is partnership from the Milwaukee Public Schools, from my administration, our health department, and our federal partners with the Centers for Disease Control. And I am grateful. I know that the superintendent, the school board president are grateful. Most importantly, families in Milwaukee are grateful for this partnership because it means greater health access for kids in Milwaukee. That's what this is about. And as the President of the United States gets ready to deliver a State of the Union address tonight, I just want to put a finer point on the fact that these are the sorts of partnerships that really make a difference in communities across this country, right? Because of our partnership with the federal government, we're going to be able to make a positive impact on the lives of kids. In communities across this country, right? Because of our partnership with the federal government, we're going to be able to make a positive impact on the lives of kids. In communities across this country, right? Because of our partnership with the federal government, we're going to be able to make a positive impact on the lives of kids.